My name is Jeeves Wijesuriya. I'm a GP and public health trainee in East London, and I'm a member of the Junior Doctors Committee, and I'm also a member of the Junior Doctor Contract Negotiating Team. I'm running for BMA Council because I know, having been involved with these contract negotiations, that whatever happens, once we have a new contract, the work is not done. In fact, when there is a new contract in place, by whatever mechanism that occurs, the work will only just be beginning. In fact, with this huge change that is coming to healthcare and to the way that we provide it, we need to make sure that we can provide the best care possible, that the safety measures we've put in are real and have teeth, the educational changes we're making are real and have teeth, and to do that effectively, we need support at the very highest level from Council. We need support for the unbelievable grassroots movement that we've had from junior doctors, the huge spike we've had in membership that we need to make sure we retain, and more importantly, that we represent well. And that means support, resources and funding for things like the Junior Doctors Conference, for Junior Members Forum, for all of those vehicles that we have to make sure people are being heard. And that's going to be so important. I think that now more than ever, we have a responsibility to represent doctors, to fight for them and make sure that not just they have a safe working environment, but also that we have an environment that is conducive to producing the best possible patient care. The BMA have been fantastic with that, in my opinion, actually, with this cause. And I think we have so much to build on. I think that Council is so important to this because actually, we need a way to make sure that the support we need for junior doctors, for consultants, for GPs particularly, and all of those different groups exists. I think we need to make sure that that's there at the highest level at Council, and that actually we have greater transparency and accountability to make sure that that Council is providing members with what they need, with what they want. As a junior doctor that's been on the contract negotiating team and working really closely with Johan, I've had wonderful insight into a lot of the things that we are working on and trying to put in place to create both safety for patients and the best possible facilities for doctors, making sure that there are educational priorities, that training is acknowledged as work, as it should be. And I think there's so much that we're doing that we need to make sure is supported beyond just this August, that there is so much that we need to support and achieve in terms of those educational groups, in terms of creating national frameworks for facilities, both for rest and education, that there's so much we need to do to make sure that the Guardian and exception reporting is working, that we are holding this government to account, this Department of Health and NHS employers to account on the promises they've made. And actually that fight is huge, and that's where we're going to need Council support. And that's why I think I want to run, because I have quite a unique knowledge of that. Thank you so much for taking the time to watch this video. Thank you for your support. I hope you'll consider sharing this video and consider voting for me in the upcoming BMA Council elections. The votes will be coming out via post in March and they'll be due in April. I hope you'll consider voting for me.